Good afternoon, everyone. My name is Daniela Macierer. I am a postdoc fellow at the Research Institute of McGill University Health Center, and I am working on the project to develop an online self-management program for kidney transplant recipients, the Get on Track study, and as well, I am a CNTRP trainee. It's my pleasure to introduce our today's speaker, Dr. Tania Janaudis-Ferreira, and she's going to talk about exercise for solid organ transplant candidates and recipients, a joint position statement of the CST and Can Restore. Dr. Tania Janaudis-Ferreira is an assistant professor with the School of Physical and Occupational Therapy at McGill University in Montreal. She is also a junior scientist with the Research Institute of the McGill University Health Center. Her research program focuses on developing and evaluating innovative rehabilitation interventions for people with chronic lung disease and solid organ transplant patients. She is also a co-founder and co-chair of the Canadian Network for Rehabilitation and Exercise for Solid Organ Transplant Optimal Recovery, Can Restore. And she has been an investigator with the CNTRP since 2015. Well, I hope all enjoyed the presentation. Dr. Tania?
Thank you for the introduction, Daniela, and good afternoon, everyone. So what I'm hoping to do today is to describe the evidence for exercise limitation and exercise training pre and post solid organ transplant, and to briefly describe the procedures for developing position statements that was created by the leading clinical practice committee of the Canadian Society of Transplantation, and to discuss the evidence-based and expert-informed recommendations for exercise training pre and post-transplant. I have a lay summary here that CNTRP asked me to add to this presentation. Is pretty much what I have just said, but this is for patients and the public if they want to watch this webinar later. So the idea to create this document, this position statement, came from the leading clinical practice committee of the CST, and it has been endorsed by the Can Restore network. So the leading clinical practice committee of the CST did a survey with their members, and apparently one of the topics that the members said that they would be interested in having in terms of a position statement was about exercise and rehabilitation. So this committee contacted me and contacted my colleague Sunita Mathur from the University of Toronto, and they asked if we wanted to form a group to develop this position statement. So as I said, it's a joint position statement between the Canadian, with the Canadian Society of Transplantation and the Can Restore network. The Can Restore, as Daniela just said, it stands for Canadian Network for Rehabilitation and Exercise for Solid Organ Transplant Optimal Recovery. It's a network dedicated to achieving optimal well-being in transplant patients through exercise and rehabilitation. And to achieve this, Can Restore disseminates evidence-based knowledge in exercise and rehabilitation in transplantation, establish research priorities, share practice guidelines, and cultivate national and international partnerships. So first, I would like to say that I have not done this work alone. As I mentioned before, I co-chaired a working group with my colleague Sunita Mathur from the University of Toronto, and several other people from different places in Canada helped develop this position statement. So I'm here today to present this position statement on behalf of our working group. So I'll start by giving some background information about exercise limitation and its implications in this population. So exercise capacity is reduced in solid organ transplant candidates and recipients due to several factors. In the pre-transplant phase, the primary organ failure is the key factor limiting exercise capacity, particularly in those with advanced heart or lung disease, where circulatory or ventilatory limitations result in reduced exercise capacity. However, there are other factors that can contribute to exercise limitation across all types of solid organ transplant candidates, regardless of their underlying disease. And these factors can be anemia, deconditioning, which leads to maladaptation of skeletal muscle atrophy, weakness, malnutrition, fatigue, and cognitive impairments. Pre-transplant exercise capacity is an important clinical marker. It is used for listing in heart and lung transplant candidates, and it's being shown to be associated with mortality on transplant wait list in heart, lung, liver, and kidney transplant candidates. Post-transplant, we see an improvement in exercise capacity, and this is probably due to the improvement in the organ function, especially when it's heart or lung, but also because we see an improvement in symptoms overall. However, it's been shown that exercise capacity remains reduced to 40 to 60% of predicted in the majority of adult solid organ transplant recipients, even years post-transplant. So there are several factors that can impact exercise capacity post-transplant, and here we have a list, and they can be, for example, prolonged hospitalization, low levels of physical activity, corticosteroid-induced myopathy, mitochondrial dysfunction from using calcineurin inhibitors, skeletal muscle atrophy and weakness, and episodic illnesses, for example, infections and rejections that these patients may experience after transplantation. So this slide here shows the secondary effects of transplantation or of having had an end-stage disease for a long time in different body systems. And it also shows the potential benefits of exercise training on these issues. So these benefits of exercise have been demonstrated in many chronic disease and also in the transplant population, specifically in transplant recipients. So we'll see today, I will walk you through the evidence for exercise training pre and post-transplant. You will see that the most evidence that we have is in the post-transplant phase. So there is a broad range, as I said, of literature on exercise training in chronic disease and also in solid organ transplant recipients. There's some evidence in solid organ transplant candidates. However, there are no guidelines for exercise training in adult or pediatric solid organ transplant candidates or recipients, which limits the ability of healthcare professionals to counsel patients and prescribe exercise. So this lack of guidelines have been identified by patients, by transplant physicians, and by exercise professionals. For example, in a study that some PT students, physiotherapy students from McGill conducted in 2017 with, this was an online survey with transplant recipients. This study wanted to assess the levels of physical activity in these patients and also the barriers to being physically active. So among many different barriers, the lack of provision of exercise guidelines was identified by transplant recipients as one of the barriers to being physically active. And so these patients, they don't really know how to exercise. They feel they don't have any guidelines that they can look at on, you know, what type of exercise they should be doing, how often, and so on. There's another group of students from McGill, PT students, that did another study. This time they included transplant physicians in Canada. This was also an online survey to ask about practice patterns and barriers to counseling physical activity in solid organ transplant recipients. And this study showed that only 18% of the transplant physicians who responded to this survey felt very confident in counseling physical activity for solid organ transplant recipients. And they also, these physicians, they identified many different barriers to counseling on about physical activity. And one of the barriers that was identified was also lack of exercise guidelines. In a qualitative study that I recently conducted in my lab with exercise professionals, during the interviews, we noticed that exercise professionals felt that they would be more confident treating solid organ transplant recipients if they attended workshops or were provided with educational resources. And also exercise professionals expressed the need for evidence-based practices. As to their knowledge, there are no exercise guidelines for solid organ transplant recipients. So you can see that, there is a lack of guidelines, and this lack of guidelines, this issue have been identified by patients, transplant physicians, and exercise professionals. So the aims of this position statement were then to provide evidence-based and expert-informed recommendations for exercise training pre and post-transplant in adult and pediatric solid organ transplant population, and to provide recommendations on the outcomes relevant to exercise training and physical function that should be evaluated in solid organ transplant. However, for the sake of time today, I will focus my presentation on the adult population excuse me, and we will not talk about the recommendations for pediatric population today or about the outcome measures that we recommend in the context of exercise and rehabilitation. So I'm happy to come back another day to talk about these two other topics. So these are the questions that we try to address in our position statement. So what is the evidence for exercise training in adults and pediatric solid organ transplant candidates and recipients? What types of exercise training are recommended in the pre-transplant phase? What types of exercise training are recommended in the early and late post-transplant phases? And what are the outcomes relevant to exercise and or physical activity that should be measured pre and post-transplant? Again, as I mentioned before, my presentation will be focusing on the literature on adults, solid organ transplant candidates and recipients. So in terms of the methodology for creating, developing this position statement, we follow the standard operation procedures for developing position statements that were created by the leading clinical practice committee of the CST. So they recommended that we formed a working group with experts in the area. So that's what my colleague Sunitha Mathur and I did. They had specific information about the methodology that they want us to follow, the required sections that they want us to include in the position statement, and also very specific information about the review process. So there was a multiple review levels for this position statement. So after we draft the position statement, everybody, all the members from the working group reviewed the document. Then the CST representative sent this draft to all the members of the CST via email, so they would have the opportunity to give feedback on this position statement. Then this draft, after making the revisions based on this feedback, this draft was sent to the board of directors of CST, this group also had the opportunity to provide feedback. We made changes according to their feedback, and now it's being, this document has been submitted to a journal, and it's undergoing peer review as well. So you see there's multiple review levels involved. So we search Medline and PubMed to look at try to see what the evidence is in this area. So we looked for systematic reviews or randomized controlled trials in exercise in solid organ transplant candidates and recipients. When systematic reviews or RCTs were not available, we looked at studies that included any type of design. So we had the document, as I mentioned, had the different sections. So today I'm focusing on the adult section. We had the pre-transplant section and then post-transplant section. For the pre-transplant section in adults, we based we reviewed the evidence based on one systematic review in lung transplant candidates and one systematic review in heart failure with LVAD as a bridge to transplantation. Systematic reviews also exist on chronic conditions that lead to transplantation. So we review those systematic reviews as well. And we made the recommendations based on the evidence and based on expert opinions. For the section about exercise post-transplant in adults, we reviewed a recent systematic review meta-analysis that was conducted in my lab. So this systematic review is not published yet. It's just in its final phase. But we reviewed 29 RCTs that were included in the systematic review. And we made the recommendations based on the grade system and on expert opinion. So grade, I don't know if everybody's familiar with the system. Grade stands for Grading of Recommendations, Assessment, Development, and Evaluation. Is a transparent framework for developing and presenting summaries of evidence, and provides a systematic approach for making clinical practice recommendations. So it's the most widely adopted tool for grading the quality of evidence and for making recommendations. I will be talking a little bit more about it when we come to the recommendations. So before reviewing the evidence for exercise pre-transplant, or the evidence for rehabilitation as we call, I would like to review the goals of rehabilitation in solid organ transplantation. So the goals are to optimize physical fitness prior to transplant, to improve waitlist survival and quality of life, and improve early post-transplant outcomes, such as we would like to have shorter hospital length of stay and functional independence at hospital discharge. So basically what we see in terms of evidence for exercise pre-transplant is that there is a lack of study that specifically includes solid organ transplant candidates. So most of these studies and systematic reviews in this area are included end-stage chronic conditions that may lead to transplantation. For example, end-stage kidney disease on dialysis, or patients on left ventricular assisted device as a bridge to transplantation, or people with heart failure or liver cirrhosis. So we found 3 systematic reviews that included studies that looked at the effects of exercise in transplant candidates. The one by Wallen and colleagues, this one here, was published in 2016 and included studies in heart and lung transplant candidates only. This study here, by the second one on the screen here by Hoffman and colleagues, was published in 2017. And included lung transplant candidates, a study that included lung transplant candidates. And this one here, also published in 2017, included studies that had included patients with liver cirrhosis or patients that were waiting for liver transplantation. So I will start by this study. I will take you through this systematic review so you have an idea what the evidence is. So I will start by the study by Hoffman and colleagues that included lung transplant candidates. So the systematic review by Hoffman and colleagues included 6 studies, so 2 RCTs, 2 prospective pre-post studies, and 2 retrospective studies. These studies included a variety of diagnoses of COPD, IPF, and cystic fibrosis, for example. And in summary, most of the studies showed improvements in 6-minute walk distance, but data on health-related quality of life was conflicting. So going through what did the review by Brustia and colleagues show? This review included 4 studies only. The authors did not really report if the included patients actually had undergone transplant or not. But in summary, the authors of this review found that exercise was safe. For example, did not increase hepatic venous pressure gradient, which is one of the concerns that normally healthcare professionals have in this population when they exercise. 1 study showed improvement in health-related quality of life. 1 study showed that exercise reduced fatigue, and 2 studies showed improvement in muscle mass. Looking at the results of the meta-analysis of this, the authors also performed meta-analysis, conducted meta-analysis in this study, but there is no significant changes in aerobic capacity or BMI, muscle mass, and this was likely due to the small number of studies that were included in this systematic review. It was only 4 studies. So in terms of kidney transplant candidates, so there are 2 studies that specifically included kidney transplant candidates. So one was an RCT that offered, and it's showing now on the screen, this study offered a mindfulness and yoga intervention to an intervention group and a phone-based support group to the control group. So the primary outcome of this study was anxiety, and the second outcomes were depression, sleep quality, pain, fatigue, and health-related quality of life. There is no difference in any outcomes between groups, except that the mental component of the health-related quality of life measure was improved in intervention group to a greater extent than the control group. But as I mentioned, the outcomes of these studies were not really related to exercise, was more related to anxiety, depression, and sleep quality. There is another study that was recently published, if I'm not mistaken, it was now in 2019, that specifically included kidney transplant candidates. So this study included patients that had end-stage renal disease, who were estimated to be within 3 to 6 months of kidney transplantation. They offered a hospital-based exercise program that included aerobic, resistant, and stretching exercise. And this study showed that by 2 months of rehabilitation, there is an increase in physical activity in the patients that participated in this study. 5 participants received kidney transplantation during the duration of the study. And these 5 participants had shorter length of stay compared to an age, sex, and race matched controls. So this is a very promising results. It was a feasibility study, very small study, but showed some positive results there, even in terms of outcomes post-transplant. So although there are very few studies including kidney transplant candidates, I just presented the 2 studies that we found in the literature. So although there are very few, there are many studies that included end-stage kidney disease, so patients that were on dialysis. And these are 2 on the screen here. You can see 2 systematic reviews in this topic that shows strong evidence that exercise improves aerobic capacity, walking capacity, muscle function, and health-related quality of life in chronic kidney disease. So moving to heart transplant candidates. So in the heart organ group, the studies are focused on heart failure or patients with left ventricular assisted device as a bridge to transplantation. So these studies offered supervised aerobic and or resistance training in a continuous or in a continuous way, or using interval based exercise. And these studies, as I said, so just going back, these were 2 Cochrane reviews that I'm going to go through the results with you now. So the Cochrane review by Rees and colleagues from 2004 included 29 studies, and they had more than 1,000 patients. And this Cochrane review showed improvements in VO2 peak, exercise duration, work capacity, and 6-minute walk distance. The Cochrane review, it's more recent, from 2014, from Taylor and colleagues, included 33 studies that included more than 4,000 patients. And this review showed a trend towards reduced mortality, lower number of hospital admissions, improvement in exercise capacity, and quality of life. So that was pretty much a review of the evidence for exercise in transplant candidates by organ groups. This is how we also divided the document. So we provided information by organ groups. So another question that is very relevant, and normally some professionals really want to know, is exercise pre-transplant safe? So some professionals might be reluctant to refer patients to an exercise program or prescribe exercise to this population. You know, these patients, some of them or many of them may have been sick for a long time. They may be frail. They may suffer from sarcopenia, fatigability. So many professionals do not feel comfortable exercising these patients on this phase. But as I said, there are studies, as I mentioned before, there are studies in this area that have shown benefits for this population. And in terms of safety, there is few studies in lung, liver, and kidney that reported adverse events. But they did not really report serious adverse events. They report some, but they were very minor. And in general, the studies show that exercise pre-transplant is safe. There's a large study, I guess the largest kind of safety trial is this one here by O'Connor and colleagues. That's called the Heart Failure Action, Efficacy, and Safety Trial. This study included 2,000 patients across 82 centers. They found no significant effect of exercise on mortality and no serious adverse events from exercise training. So we can say that exercise training pre-transplant is pretty safe. So now we're going to move to the evidence for exercise post-transplant. And before talking about the evidence, I would would like to review the goals for the goals of exercise post-transplant. So the overall goal is to help transplant recipients regain function and return to work, as well as to their family and societal roles. Specific goals are to increase general mobility, and this is normally more related to early post-transplant, but also to improve functional exercise capacity, muscle strength, quality of life, and outcomes related to cardiovascular risk factors. So when we review the evidence for exercise post-transplant, we use the systematic review that I mentioned before that has been conducted in my lab with my collaborators and my students, and this study included 29 RCTs that looked at the effects of exercise post-transplant. So again, this study is not published yet, but is almost there. So I will just quickly review what we found in this systematic review and meta-analysis. So we included 29 studies in total. 21 were unique studies. So sometimes there were two publications from the same study, but they reported different outcomes. In total, there were 852 solid organ transplant recipients that had been included in these RCTs. So 11 RCTs were in kidney, had included kidney transplant recipients. 6 were in heart, 2 in lung, 2 in liver, and none in pancreas. So we looked at the effects of exercise in some specific outcomes. So one of the outcomes that we looked at was exercise capacity, so particularly VO2 peak. And we did a meta-analysis, and we found that overall there was an improvement in VO2 peak in intervention group compared to the control group. So as I said before, we use the GRADE evidence to look at the level of evidence for this outcome. And we can say that the level of evidence for exercise capacity measured by the VO2 peak in transplant recipients is really high. We looked at quality of life. So most of the studies included assess quality of life using the SF-36. So we were able to do a meta-analysis, and we saw an improvement in physical functioning, also in physical role functioning, social role functioning, and mental health, and also in general health. We did not see an improvement in bodily pain or emotional role functioning. And again, the level of evidence, it was high for this outcome as well, the strength of evidence. We also looked at leg extension force. So it was measured in 7 studies in a variety of ways. All but one of these studies reported an increase in leg extension force. We also did a meta-analysis using this data, and we saw an improvement in leg extension force in the intervention group compared to the control group. And the level of evidence, the strength of the level of evidence was also very high for this outcome. So these studies included different other outcomes as well. For example, inflammatory markers. So 5 studies included this outcome. Blood pressure, 11 studies. Fasting glucose, 5 studies. BMI, total cholesterol, triglycerides, and bone mineral density. So the studies included, these outcomes, but there are a variety of, so it was, the results were conflicting. So some studies showed improvements in these outcomes. Other studies showed no improvements in these outcomes. We did a meta-analysis with all these studies, but the only outcome that we could see an improvement in intervention group compared to the control group was in blood pressure. We did not see an improvement overall in these other outcomes here after the meta-analysis that we conducted. So these are the characteristics of the exercise training programs that were included in the studies that had been included in systematic review. So what we want to know here is there an optimal type of training that we should be using with these patients? So the type of training that these studies offered varied considerably. So for example, in terms of time post-transplant, there are some couple of studies that offered exercise immediately after discharge, but other studies included or offered exercise 4 years after surgery. In terms of duration of exercise intervention, it ranged from 8 to 50 weeks. In terms of type of exercise training, they included aerobic, resistance, or a combination of both. In terms of frequency, it ranged from 2 to 7 days a week. And in terms of setting, they were this exercise were hospital-based or they were home-based type of exercise. So it's really hard to see what is the optimal type of training that these patients should be doing, but it seems that the exercise that are moderate to vigorous intensity level, 3 to 5 times a week for a minimum of 8 weeks are the ones that are most effective. So we also looked at adverse events in these studies to see if exercise is safe post-transplant. Only 4 studies, the studies that included actually heart transplant recipients, only 4 studies reported adverse events, and they reported there was no adverse events. There's one study by Mitchell and colleagues that included lung transplant recipients. That study reported a no statistically significant increase in rejection episodes in the exercise group. So this is not something that the studies are actually reporting. So very few studies report about adverse events. So we kind of ask ourselves if either there's no adverse events at all or if they're not reporting it. But the studies that did report, we did not see any big issues in terms of safety there. So summarizing the evidence that I just presented to you in terms of evidence for exercise pre-transplant and post-transplant. I just put something together here. So exercise in solid organ transplant candidates and recipients is safe. There is limited evidence for the benefits of exercise in transplant candidates. However, there is evidence across pre-transplant conditions that shows improvements in exercise capacity, quality of life, but not clear which training modalities are most effective. So there are few studies included specifically transplant candidates, but there is many studies that included people with end-stage disease that leads to transplantation. So we can borrow that evidence to make it, we could borrow that evidence to make our recommendations. Definitely the stronger evidence is in the post-transplant phase because there are many RCTs that have studied this topic. Exercise post-transplant improves aerobic capacity, leg extension force, health-related quality of life. So in our systematic review, we saw an improvement in physical functioning, general health, social role, and mental health, and also in blood pressure. The exercise programs are highly varied, and there is limited data on mortality and post-transplant outcomes. So hospital stay, for example, and graft function. So most of these studies have focused on outcomes that are directly related to exercise. Few studies looked at post-transplant outcomes when they do, for example, exercise pre-transplant, or even in mortality or graft function. So this is, so we based our recommendations. Now we're gonna move to what we recommended in this position statement. So again, we base our recommendations based on the evidence, whether we found in the literature, and also it was based on the expert opinions. So we had, as I mentioned before, a working group with experts in this field, and we had a discussion after we had the draft, we had written the draft of this position statement, and we came up with some recommendations. So these are the recommendations for exercise in solid organ transplant candidates. So we recommend that exercise training in the pre-transplant phase is safe and should consist of aerobic training or combined aerobic plus resistance training. There is insufficient evidence to provide guidelines on the dose of exercise, for example, frequency, intensity, type, and time to obtain benefits in the pre-transplant phase. And there is insufficient evidence for the program length or duration required to obtain benefits in the pre-transplant phase. Exercise programs should be supervised, but can be conducted in a hospital, inpatient or outpatient setting. There is some evidence for home-based programs, but there are very limited evidence right now. So we recommend that these programs need regular monitoring by an exercise professional. So these were the recommendations that we came up with for the exercise in the pre-transplant phase. These are the recommendations for exercise in the post-transplant phase, so in solid organ transplant recipients. Here it's where where we have more evidence from the literature. So we recommend that there is high quality of, we said that there is high quality of evidence that exercise training improves maximal exercise capacity, lower extremity muscle strength, and health-related quality of life in lung, heart, kidney, and liver recipients. Exercise training in the post-transplant phase is safe and should consist of aerobic training or combined aerobic plus resistance training. And to obtain benefits early or late post-transplant, exercise training should be of a moderate to vigorous intensity level, 3 to 5 times a week for a minimum of 8 weeks. Early post-transplant, for example, between 1 to 6 months, and or in case of medical instability, exercise programs should be supervised and can be offered in an outpatient setting or at home. And late post-transplant, so more than 6 months, structured exercise programs or physical activities can be unsupervised and offered at home or in private fitness centers by an exercise professional. So again, we had recommendations for exercise in the pediatric population, and also recommendations for what type of outcomes we should be using in the context of rehab and exercise. But again, for the sake of the time, I was not able to present it today. But you will be able to read it in the position statement once it's published. So in terms of research directions, we made some recommendations as well. So, so the effects of rehabilitation on, I think these are the areas that we should be focusing on. So we should be focusing on now on the effects of rehabilitation or exercise pre-transplant on wait list outcomes, for example, healthcare utilization, mortality, frailty, and early post-transplant outcomes. For example, look at length of stay and frailty. So most of the studies that included people with end-stage disease or even transplant candidates, they focused on outcomes that are directly related to exercise, for example, exercise capacity, physical function, also health-related quality of life, but they looked at these outcomes before the transplantation. So it would be nice now to start designing studies that can actually see what the effects of the rehabilitations are on post-transplant outcomes. So for the post-transplant area or section, or what I think we should be focusing on is on innovative strategies to enhance long-term adherence to exercise and physical activity post-transplant. Because we have now enough evidence showing that exercise post-transplant is beneficial, is effective in improving aerobic capacity, muscle strength, and health-related quality of life. And we have some evidence. Unfortunately, we're not able to found very good results from the meta-analysis, but there's some evidence that it improves blood pressure, for example. There are other outcomes that we should be focusing on in terms of cardiovascular risk factors, diabetes, but one thing that we should be, I think, be focusing on is, on innovative strategies to enhance this long-term adherence. So we know now what the benefits are, but now how can we actually make the patients adhere to an active lifestyle post-transplant? So these are, I think, in my opinion, in the opinion of the group, is the area that we should be focusing on in terms of future research directions. And also in terms of post-transplant phase, we should be focusing on different outcomes. We should stop doing studies looking at effects of exercise on muscle strength, on quality of life, or exercise capacity post-transplant. This has already been shown that it's improved. We should focus on different outcomes such as physical activity, cardiovascular risk factors, diabetes, and immune function. So I would like to tell you to stay tuned for the publication. So the position statement, as I mentioned, has been written, has been reviewed by different groups and people, and now it has been submitted to the American Journal of Transplantation. So hopefully we'll be hearing from them soon. So stay tuned for the publication. I think you will enjoy reading it. So I would like to thank the CNTRP for inviting me to present this webinar today. Thanks for everybody who were listening to me for for 43 minutes now. And and I have to thank the leading clinical practice committee from the Canadian Society of Transplantation who invited us to develop this position statement. My colleague Sunita Mathur, who co-chaired this working group with me, everybody from the working group, members of the Can Restore who participated, and members of my lab who have done studies that actually contribute to this to the development of this position statement as well. So thank you everyone, and I'm happy to answer any questions that you may have.